Give him the gifts and he starts crying and he couldn't get used anything. You're just happy to have him.
Yeah.
And here we are.
Yeah.
I wouldn't exactly. Well, you're. Well, as soon as I heard the other day, I thought you.
Quit driving. And the nursing home, they couldn't go.
So I kind of control. I changed it. Thank you. And I'm just looking at another one they don't have. I saw that and I put it in my, I saved it. Thanks for catching that. I didn't.
Okay, we'll call the meeting of the December Health and Human Services Department Board to order. Welcome for coming in December. It's cold now, and, but no snow or ice on the ground. So hopefully we'll get lucky on all of our meetings throughout the winter. Due to COVID-19, this meeting is conducted under Waupaca County Resolution Number 8, 2020-2021, and Governor Evers' Emergency Order Number 1. Please note the following. This meeting will be broadcast for remote access on a live stream on YouTube on the address of that. This meeting may inadvertently cause the form of other county committees or county board of supervisors, no business decision of any other committees or the board of supervisors will be conducted at this meeting. Participation in person is permitted. This meeting will be conducted using guidance regarding social distancing. Table and chairs will be arranged accordingly. Face coverings are required unless an exception applies. This meeting and all other meetings of this committee are open to the public. Proper notice has been posted and given to the media in accordance with Wisconsin statutes so that the citizenry may be aware of the time, place, and agenda of this meeting. We have an agenda in front of us. Is there a motion to approve the agenda as written? Moved by Jan, seconded by Sue. All those in favor signify by saying aye.
Aye.
That's been approved. Minutes of the previous meeting. We got a chance to look at those and decide whether they are accurate or need some sort of change or modification. Jan?
I make a motion to.
Been moved by Jan to approve the minutes as written. Seconded. Those in favor by Jody. Those in favor signify by saying aye. Aye. Opposed, and they are approved as written. Okay. All right, public comment. Anybody wishing to address this committee under public comment? Okay, seeing none, we'll move on. The general board business, our public health officer with health COVID-19 update. Jim?
Hello. I will just start with just a quick snapshot of kind of the situations that we're at today. I brought up our dashboard to kind of provide, the current numbers and status. I guess I'll start by saying, it's been a while, but a little bit of good news, and I say that cautiously, but a little bit of good news that we have seen a tick down in our case activity. The last 2 weeks, we've seen our numbers drop a little bit after a sustained 7 to 8 week surge with some really high level of cases, where we were averaging around 50 cases a day. That has, the last 2 weeks, that number has dropped, and we're actually been more probably in the high 20s per day. So a little bit of good news. I'm definitely optimistic, but I'm also very cautious of that. Coming out of the holiday weekend and deer hunting weekend, and we'll see if if it was just a short period here that we've had a little bit of downturn, or hopefully it's something that continues to trend that way. So our numbers, if you look at our active number, right now that's 228. 2 weeks ago, we were pushing 600 active. That's how many people are actively in isolation for being positive with COVID-19. So that's good to see. And we are hearing and seeing that in our general region with our neighboring counties as well. The state, there's still a lot of counties that are still experiencing some very high levels, critical levels. The state's burden level that they have on their website to measure burden as far as new cases in the last 14 days per 100,000 population, they have a measuring level that goes from low all the way up to critically high. We were in that critically high for those 7 or 8 weeks that I mentioned. We actually, this last week, we dropped down into the very high level. So we are still at a very high level of case activity. However, like I said, the good news is that we have taken a step down, which has been very welcome. So we're hopeful that continues. Here's our, this graph here shows our daily numbers. You can see daily confirmed numbers have dropped. I was going to show also by week. I'll make that a little bit bigger. Here's the big surge I was talking about that we went through. We were basically at 300 cases per week for 7 weeks straight. And finally, 2 weeks ago, it dropped a little bit. And then the last week as well, it dropped a little bit. So maybe a little bit of light here. But, again, I say that cautiously. It could definitely turn back the other way if we have some sort of big outbreak or super spreader event, or people's maybe stop working with the guidelines, wearing their masks, social distancing. But like I said, it's a little bit of good news. Some of our numbers are starting to go in a direction that we would hope they would. I'll also add, this is a new piece of information that we've added to our dashboard. This is probables, and this is a total number of probable cases. And what probables are they're not a confirmed case, where a confirmed case is a PCR test. A probable is someone who's got the rapid antigen test, which we're starting to see way more of those available. And we want to incorporate that because a lot of, when people get tested, they have the option now to get antigen test. And we want to make sure that that's captured as well, because that's a positive individual too. If you test positive for an antigen, you're also considered positive. It's just probable, and they're listed probable because the accuracy of antigens maybe isn't quite as good as the PCR gold standard. You may also be considered a probable if you had an antibody test, or if you were symptomatic, were a close contact, and never got tested. But it's very likely if you're like a household contact from someone who is confirmed, then you likely are a probable as well. But I can tell you the majority of the probable cases right now are folks that have gotten tested with a rapid test. So that's why we want to put that number. So you can see the change from yesterday. We had 10 new probable cases, which are most likely antigen tests. And then we had 28 new cases today. So really we had 38 new cases today. So that's a little bit of that. One thing I want to talk about too, we do list the deaths on our dashboard, and this is a pretty high number, especially population-wise, ratio-wise for the county. We've had 126 reported fatalities, and that number is we don't determine that number. That number is determined by the doctors and by the medical examiner, and they go by guidance from the CDC. And so we wait to hear from the medical examiner before we put a number up here. And it's actually, the state has now started listing deaths by confirmed and probable. And probable means, again, they may have been tested with a antigen test, or it may be a secondary cause or a secondary listing on a death certificate. So the state does break them down by confirmed and probable. We've just combined both of those, and we have that explained down here on our dashboard, what it means for our deaths count. And there's a link right to the state's website where you can search the two numbers, confirmed and probable. One thing, I'm just going to quick go back to the probables too. Probably this week we'll incorporate some more graphs and some more data that incorporate the probable cases as well. So we have both confirmed and probable numbers, because I think it's important to understand the whole picture with how many cases there are with both of those. So did a little update on that. Some of the other updates that have been going on, vaccine, you've probably heard a lot in the news. So we're doing our preparation here. Certainly we've had meetings weekly, and it's actually picked up to multiple meetings per week on our preparation for the vaccine. The CDC has provided their guidance on the priority groups, which they've identified as healthcare workers and long-term care residents. So that will likely be the first groups that, when the vaccine is ready, that will be available for those priority groups. Next week, the FDA meets to make a decision on the first vaccine that applied for emergency use, which is the Pfizer vaccine. And if that gets approved next week, the wheels will start to go in motion as far as delivering vaccine to hubs across the country. And then within the state, it will get distributed to strategic locations and then delivered, if the state determines that they're going to use CDC guidelines and get the vaccine to healthcare workers with long-term care facilities, it'll get distributed to those facilities. All healthcare and pharmacies and public health all needed to apply for to be a provider for the vaccine, which we have done as well here at the health department. We'd probably be at the health department. We'd probably be more involved with some of the when it gets to the public vaccination, when it comes more available. We may be doing some smaller groups, some of the next level groups, maybe like EMS and fire. And then as more vaccine comes available and we can give it more to the public, we might be involved in maybe some mass vaccination distribution. And kind of a piece of that too is we did a flu mass vaccination the last 2 weeks at the fairgrounds, a drive-through version of that, and that would really work well for us twofold. We provided flu vaccine to the public, and we did it through a drive-through. That's the first time we did a drive-through type of clinic, and I think that was good practice and preparation for us if that's something we look to do with the COVID vaccine too. So I'd anticipate if the FDA does approve emergency use for Pfizer, that maybe there's going to be some logistical pieces that have to happen before it actually gets to facilities. But the following week or two, you'll start hearing that maybe it gets to the facilities and start getting shots in people's arms. And then as more is manufactured and more of the other vaccines get approved, we'll continue to have more vaccine available, and hopefully we start getting in this winter and in the early spring where we get some of those vaccinations ready and more available. So another kind of piece, kind of a little bit more light kind of coming through here that is welcome to hopefully we can start turning the corner on this pandemic. One other piece I'll mention quick, I kind of mentioned testing. We're still able to offer the testing every Wednesday at the fairgrounds through next week with a National Guard. That deployment actually ends after next week. We're hopeful the federal government or the state is going to approve an extension of the National Guard so that we'll continue to have that availability. It sounds like that's something that is going to happen. So we'll look forward to that. There is what's been really great actually in the last couple of weeks too, the last month or so, there's more tests available. And that's been critical to this as well, to the response. Healthcare providers have gotten more testing available. We've got more of the National Guard sites available. The daily site at Oshkosh has been running for months, every day, 6 days a week. And Data Care has been able to procure some testing where they've done some mobile site testing, drive-through testing, and they've been in New London and Waupaca weekly. And as I mentioned, healthcare is getting more tests available as well, including those rapid tests. So hopefully that continues to progress as well. We have to have the testing capability available to help us identify, folks that are sick, and so we can isolate and quarantine as fast as we possibly can. Contact tracing continues to be, a core foundation to response. We're continuing to do that. Still 7 days a week. Our staff are still getting a hold of everybody who has a positive test. And we've been fortunate. We've managed to make it through the surge so far, and we've still gotten a hold of everybody within 24 hours. So we're still doing that disease investigation, contacting positive cases. What we had to change was, over a month ago, where we weren't able to continue to contact the contacts of positive cases. But we've been able to continue contacting positive cases, which in some counties and municipalities, they haven't been able to manage to do that just because of the overwhelming number. But we've been able to continue to do that, and we are continuing to do that. As this has been the case throughout this pandemic, things change fast. Guidance change, science changes, we get more information, more data. You may have heard today too, CDC has provided some new guidance for quarantine, some new options. So the state's gonna review those, and we potentially will have some options for maybe some shorter quarantine, which will certainly help with compliance with quarantine if those get approved by the state and they provide their guidance, which I anticipate they will. So as this has been a case, it continually evolves, and we're continuing trying to adjust and do our best to keep on top of everything. And that's going to be the case going forward. I do feel like this is just kind of me saying that I think maybe we've gotten to the halfway point here where, like I kind of mentioned before, we have maybe some light coming through the tunnel here where we've had a little bit of a break with cases going down. Now we're getting closer to the vaccines, and hopefully we can we'll make it through to this second half of this pandemic, and it won't be as hard as the first half, because it certainly has been hard. And you guys all know how hard it's been for everybody, for people's health, for people's businesses, and every facet of life. So I guess I'll leave it there. I guess if anybody has any questions, I can take some questions.
Hey, Chuck, 126 deaths.
Mhm.
What age brackets are they in?
I don't have the specifics in front of me, but the majority of those are in the older age demographic. So, 65 and older.
That to me, because we have an aging community, I would expect that to be.
Yeah, I mean, we have, as you mentioned, we have we have an aging community. We have several long-term care facilities. Our long-term care facilities have definitely been affected by this.
Thank you.
Anyone else have a question? Well, Jed, again, thank you for a great report, and hopefully your prognostication of better days coming quickly will come true. We're all certainly waiting for that, as well as waiting for the vaccination.
Yeah. Well, one thing I'll add too is, we're kind of in an interesting spot too here as we're getting into 2020, where all the CARES funding is ending too, which has supported a lot of the response. So we're also anxiously kind of waiting on how things develop at the federal government level, the CARES, and the state level too, because that is going to impact some of the things that we do going forward as well.
Is it your understanding that the vaccination program, when it gets going, is going to be free for citizens of the United States?
That would probably be, I think, my understanding. I'm not positive on that, but
That's great, because we want everybody to get it and not be staying away because it's $30 a shot or something like that.
Right.
And one other question I have, it seems like there's Pfizer and Moderna. Does the state or the county have a choice?
Well, the first they have to have them approved. So
Right.
if Pfizer is approved first, that's what's going to be available. So that'll, when Moderna gets approved, I don't know how that's going to be utilized. And both of those are multi-dose vaccinations. So if you start with Pfizer, your second dose has to be Pfizer again. And then, there's a third one too, the UK AstraZeneca. That's another one that's probably getting pretty close to, I think, applying for their approval as well. And that one doesn't require some of the ultra freezing like the Pfizer one does. So there's going to be some, benefits to some of the storage of some of the other vaccines too, and on who and how it gets distributed. as well.
Thank you. Anyone else? Okay, Jim. Appreciate your reports.
Thank you.
Okay, we have a program presentation of CCS tonight. Shauna Hanson, are you going to start it off?
Yes, I'm just gonna give a quick overview. So we're gonna be talking about the CCS program, which is the Comprehensive Community Service Program, which is a program that helps individuals of all ages by helping provide supports to address their needs, mental health and substance use. CCS is intended to assist individuals who are in need of care outside of inpatient, but if they weren't to receive services, they may end up in hospitalization during times of crisis. So it is a psychosocial rehabilitation service to those with ongoing needs meant to maximize independence. As of September 2020, there were over 9,000 people in the state of Wisconsin enrolled in the program and 46 people enrolled in the program in Waupaca County. And tonight we have a family who has participated with here to share their experience.
Good evening. Thank you very much for the opportunity to join you tonight. Introductions. This is Jill Polivka. Jill is the mother of the past CCS client. This is Colton Polivka. Colton was a CCS client. I'm Jim Mockmer. I was a CCS provider on behalf of Foundation for Living here in Waupaca. So we want to start by finding out, Jill, why did you seek CCS services for Colton?
Well, Colton had been on a list for Big Brothers Big Sisters for a long, long time. He was in need of a mentor and just somebody that he could bounce some of his energy off on. But Colton had a lot of, Colton has a split personality. So we were really dealing with a lot of that. We called him Taz. And learning how to figure out who he was inside and how he can manage these different things and thoughts and people in his life. So when CCS came out, I felt like it was a good fit to try to find the right services because we have bounced around from different counseling to find him the right services, but the counseling we had, but having that mentor made a big difference. And what we liked about CCS is it was his plan. He got to say, I think I need this. I think I need this. You know, so it was a plan laid out by him and the social worker of what he felt he needed. And what
We explored the ideas.
yeah, they explored ideas. You can go from there.
So this originated, Colton, with a lady named Heather, and I don't recall Heather's last name. She was employed here for a while and then went to Colorado or someplace. And she and Colton got together and laid out some goals and some areas to be worked on within CCS. Now, do you remember what Angela's were?
One of them was to work with siblings.
Okay, well, Colton's in a family with a whole bunch of kids. And believe it or not, they don't always get along real well. And Jill, there've been some fireworks in your home.
Yes, there has been. Colton, so before we got a SIP group of 4, it was just Colton and one other child in the home. And so we went from 2 to 6. And Colton liked to play tricks on people, but he hurt them. So a lot of things that he thought were funny were, okay, they were mean.
So there was a lot of activities that were designed within the CCS program to bring 2 of these kids together and try to get them cooperative. That was one of the goals. You remember another goal that was set? You could look in the paper, it's right there.
Bunny, we did.
Okay, so you had a dream of having a pet rabbit. Okay, now was the CCS goal to go out and get a pet rabbit?
No,
What was the goal?
to research having a bunny.
Okay, and did you do that?
Yeah.
Okay. How did you research having a pet bunny? What did you do?
We explored how to take care of them, how much they costed. And
How did you explore taking care of them? You went on a special trip with the person that was involved in doing the bunny research. Who'd you visit?
I visited a friend who knew a lot about bunnies.
This is a family that does 4-H bunnies and rabbits and the whole 9 yards. And what did you find out?
They're a lot of work.
And?
We kind of just dropped it.
Okay, so your research ended up showing you what?
You can't always rely on what you want.
Okay, so that was a very valuable experience. You didn't just go on emotion, go out and buy a bunny. Right? What else was in that original plan?
To get voter safety done.
Okay. This one I can talk about because I was involved in this one. Voter safety has been a dream of Colton's to get a voter safety certificate. There's two ways you can go about doing that. One is to come to a place like this one night every week forever and have classes with people. And we figured that was not going to be a real good learning venue for Colton. The other way is to do it online. So we chose to enroll in the online course. Now, what was that like?
It was tough. They had some stuff they did not need in there.
Now, this is the Wisconsin Border Safety, and we studied taking barges down the intercoastal waterway that goes around the South Gulf of Mexico and up the East Coast. Now, that's very pertinent to Wisconsin boating. We learned that if you're driving a barge on the Ohio River,
You could use a whistle.
Now, this was important stuff. Now, the first thing after studying a chapter, you had to take a quiz. Remember that?
Yeah.
What was significant? Did you pass it?
Yeah,
What did you get?
95%.
Remember what you told me?
That was the best I've ever done on a test.
Yeah. Yeah, and we jumped up and down, we high-fived, it was something. And eventually you passed it, didn't you?
Yeah.
Was there any other things on that original one?
The Humane Society.
So what was the goal there?
I wanted to go to the Humane Society and volunteer there.
And this one didn't work out. They apparently have a whole slug of volunteers because they basically turned us down. Just not a good fit. I thought, oh boy, you must have really a big long list of people who come and hug doggies and stuff. So from there, I was a member of the CCS team. Now this was kind of interesting because I had met Colton when, as a 6th grader, he joined our church youth group. And I was a part of the leadership of that. So I'd known him for, maybe a month. And he comes up to me one day, he says, "You're on my team." I said, "What are you talking about?" You know, I thought I was his little league coach or something. He said, "You're on my CCS team." I said, "What is that?" So I asked my wife, she used to work here, and she had some vague ideas of what CCS was. So I called Jill, and she said, "Oh, it's Comprehensive Community Services. Don't you know what that is?" So I found out and became a member of that team and was for a while. One of the goals on there was to hire a certified CCS facilitate or service person to work with Colton on some of these specific goals. And we went through 2 or 3 of these monthly meetings and nobody hired, nobody hired, nobody hired. Also, Colton turned around the meeting and says, I want you. He's pointing at him. So next day I was in Heather's office and found out what that is and went through the training and everything, which is a pretty extensive regime in order to get the certificate, and became a member. About at that point, a young named Erin Eller, who was a current social worker here, took over, and I wish she was here because I just love to sing her accolades. She was wonderful. She's got teenagers of her own. Kids don't pull any wool over her eyes. She knows what's going on, and she is really, really good work with CCS program. So what did you see as successes from Colton working through CCS?
Well, I saw a lot of successes about not only graduating his counseling of knowing who he is, what his triggers are, and how he's going to respond to them. And the mentorship and the team really helped Colton feel okay with who he is. And by us understanding those things about us, we're able to tackle the world a little bit better. And then we got recertified, we fought. And then a couple months later, somebody said, uh-oh, I don't think I think he graduated. I don't think he qualifies for CCS anymore.
He met the goal.
He had met those goals, and Jim has graciously continued to work with Colton. I mean, this is Grandpa Jim now. Grandma Chris. They're a huge part of our lives.
What did you see as successes from your personal point of view?
I used to be, oh my, I used to be horrible.
Well, you used to be this tall. How were you horrible?
I was not a good kid.
You were a good kid. You didn't make good choices.
Now I can actually pass my grades.
Colton's a freshman at Waupaca High School, and is doing okay.
And how about with your brothers?
I don't argue with them that much.
You don't have, arguing's one
It's a
thing, but
wonderful
lashing
world.
out, you're not lashing out or hurting anybody, right? That was the scary part.
So with that, folks, we would open up. Is there anything you want to ask? Ma'am?
Yeah, Colton, I understand from mom that you would like to be a counselor or help someone that has some of the same issues. Is that right? Yes, ma'am.
And that, he's actually looking forward to that. Aaron had suggested that Colton would be a good match with somebody in the CCS program, that him and Jim, that he would be with Jim and they could mentor another child that has some of these needs. And so I know that he's really looking forward to that, and then COVID hit. So it hasn't gone anywhere because of COVID. So.
Anybody else? Well, thank you for, oh man.
I would like to say thank you for all your work and help to our community and to Colton and his mom. It's things that some of us aren't involved with, and we appreciate the people like you that are in your way.
Thank you for saying it. I was one member, there was probably, I don't
He
know,
had
six
like
or
a large
seven
team. He picked a lot of
community
people.
members who were part of that team, some out of school system, some appointed in other ways, former neighbor. So it takes a whole village to raise a child, and I was fortunate enough to be a part of that.
How about we give Colton a round of applause here?
Thank you very much.
Well, I want to thank you for coming in and letting us be educated as to some of the nuances of the CCS program. And Colton, I think that did a wonderful job up here. I know that if I was your age, when I was your age, if I can remember that long, I would have been so scared in front of a group. You need to handle it real well.
And by the way, we have not seen Taz in over a year. We have not seen that snack. So it's been wonderful that he can feel it coming on and knows what he needs to do to redirect himself. So it's really been wonderful at home with that.
Thank you.
Yeah.
Good job.
Hi, Chris. Okay, we have resolution 35. And resolution 35 is a gift to the Waupaca County DHHS. And then goes whereupon Waupaca County policy requires a resolution to the county board to accept donations over $1,000. And whereas Waupaca County received a donation in the amount of $6,000 from Everdare's SOW Foundation Incorporated for the purpose of supporting Waupaca County residents in need where the other physical supports are not available. Now therefore be it resolved that the Waupaca County Board of Supervisors accept the Everdare's SOW Foundation Incorporated Waupaca County DHHS donation in the amount of $6,000. We need a motion on that. Pat,
I move to approve.
second, Dave. It's been moved and approved. Any discussion? Hearing none. Those in favor of accepting this generous donation signify by saying aye.
Aye.
And it has been accepted. I will pass around. You need your signatures on here. Okay, the advisory committee reports and updates, the CCS coordination committee minutes should be in your possession from the 30th of October. And then the CST coordination committee minutes from the same date should also be there. Any questions? Okay. While we're on those committees, there has been brought to my attention, and I'm not as knowledgeable as I should be on this, been brought to my attention about with the, excuse me, with the nutrition program we have, there is a new terminology course called HUB. New to me pretty much as of this afternoon. And I would like to ask Melissa to explain about HUBs.
Put me on the spot. That's right. So all of our communities that we're serving our participants, the larger communities throughout the county, we're providing congregate meal service and home delivery service. And as we've gone on, we have evaluated the effectiveness of each of those, how many people we're serving in each of those communities. We've gotten it down to, now we have 3 congregate sites. So with those 3 congregate sites now, we need to find a different way of describing how we're going to be serving the other participants in the communities that don't have a congregate site right now. So right now, as it is today, we have a hub in Waupaca. That hub in Waupaca right now, as it stands today, and that may change in the future, but as of today, we have a staff member at that hub that is serving our participants in Manawa, Iola, and Waupaca, the home delivered meals. Now, that happens to be in the same location as what formerly was our congregate dining site or our senior dining site, but it is not a site any longer. It is a hub. It is the place where our staff member works and manages the volunteers and the participants within that that area of those three cities. So as we're moving through here, I'm catching myself because we've said that we've referred to them as sites ever since I've had this position. So I'm learning a different way of explaining our services according to our service areas. And now keeping in mind, we're not planning on opening up congregate dining anytime soon. But when we do, our plan is that the congregate in-person dining will be at the three communities of Clintonville, New London, and Waupaca.
Part of the reason for that particular location is to use a couple of, 30 volunteers that fan out from there that get the meals. And there's also refrigeration and freezer space that is needed for those home delivery meals, as well as internet and phone service at that location where this particular person who works out of that. And there have been some conversation, great question, well, why can't they work out of their home then? My understanding is that they don't have the freezer space and refrigeration space, as well as the broadband internet in home to coordinate those things. So in conversations with Melissa, and said, well, it isn't really a site any longer. And looking at them, because the volunteers fan out from there, that's where the term hub came from.
Any questions on that particular topic?
I have one. You said that the Waupaca site is coordinating the volunteers. What does our volunteer coordinator do?
Our volunteer coordinator right now is doing the schedules for the New London site and the Clintonville site, as well as the Iola and the Manawa sites. When we're managing volunteers, we need to have someone on staff during the time of the delivery of those meals to be on call for those emergencies, to be the one that answers those calls if there's an emergency when the driver gets to the house and finds that someone didn't answer the door, finds that there's an emergency at that house and they need to call the ambulance. If someone is not home, that volunteer needs to let that site manager know, because of the next steps that the program is set up with, to ensure the safety of that individual if they are not answering their door. So we need to have a staff on site managing those volunteers while they're on the job. Does that make sense? So we've essentially had two people that are working with our volunteers. Our volunteer coordinator is recruiting volunteers and also doing the schedules for the volunteers. She's also provided a whole lot of backup for me in the various sites, taking the volunteer routes to deliver meals. She's helped me fill in at the site, so I haven't needed to package meals. She's been a great help that way, as needed. It's not a regular thing, but as needed, which saves me from having to go to those sites. So,
One other question. Before November, this was being done at the Waupaca site?
it was, so I don't remember off the top of my head the timeline on when that switched, but yes, previous to the way that it is now, our site manager in Waupaca was in Waupaca, and she was working with the Waupaca site manager and the Waupaca site manager. We're packaging the meals for both the Waupaca community and the Waupaca community.
Is that big enough there to be a hub?
Big enough.
To have an office there?
There is a limited office space and limited storage within the church. The way that it's set up right now, no. Could some arrangements be made to change that? I'm not sure, so I haven't looked into that. So I'm not
Okay, but it worked for the summer.
It did, because our Waupaca site manager was there as hands-on to package the meals, but she wasn't there and using the office space because she was going back to her site after those meals were packaged. And she was doing her office work in her office in Waupaca.
And any other questions about the term hub and how we're using it? Okay, thank you, Melissa.
Yep.
Doctor behind you. Okay, under finance, income statement overview.
I will just briefly, at the management meeting we had on Monday, just gave the team a bit of a status update, and I'll share the same thing with you, and kind of just a word of caution that happens every time around this year. We look at the income statement, and that bottom line looks really great. Right now, we're a little under 1.3 million to the good. As we go into these next couple of months, we will begin to see that number dwindling as we're seeing less in revenues. We've captured the majority of our grant revenues already. And our expenses are always, delayed in coming through for contract services and things like that. That's not to say I'm raising major red flags in any way. But I just to provide a quick snapshot, I went back to this point in time, this report for the last 2 years to see where we were at, what was that positive number, and then how did we end up ending that year. And between both of those years, roughly we averaged 1.4 million swing from the overage we showed at the end of October to where we ended in the previous year. So if we were to stay on trend, we're looking somewhere between a $200,000 and $300,000 potential loss. We still have a number of unknowns related to COVID. We don't know yet what we're going to be getting back on our winter and CCS reconciliation, which is a significant amount of revenue coming into our department. So just, we did make a caution to the management team that, as we're ending out this year, we want to make sure that we are addressing needs and that we are not, looking at frivolous kind of wants, desires, purchases as we're rounding out 2020. And Jed made a good point at that management meeting. Because of all of the additional CARE funds, that CARES Act funds that we received this year, public health as a group has utilized far less in tax levy than they would have. And so that gap, I would assume, would be far more significant. So more to come. Any questions about that?
Okay, thank you. So we have payment registered for the past period of time, or as we say, approving the bills. Is there a motion to approve the bill? Jan?
Yes.
Second? Dennis? Okay, we have a motion and a second to approve the bill. Any discussion, questions, comments? Hearing none, those in favor of approving the bills as written, signify by saying aye. Aye. Then we have a transportation grant.
No. Don't we have the table registration?
What's that?
That was approving of it.
Oh, okay. I did have a question on that.
On the bills?
Yeah,
Okay, go ahead.
Erica, on page 4, it says your contact tracing.
Yes.
What is that?
That is COVID. That would be Jed's team there doing the contact tracing for COVID-19.
Okay, and then I got one other little concern. What, on page 9, it says volunteer driver, then it says accounts payable, complete office of Wisconsin. What is
is it?
Oh, so this individual, Raleigh, is the driver, this is office supplies that. So this is the name of the driver.
Okay. Going on to the 2021, the 521 grant application. Melissa, do you have anything to say about the grant?
The only thing that I want to let you guys know about is, our grant allocation for 2021 is, just over $156,000. And that is over $12,000 less than what we received last year. As a reminder, this grant is the grant that, helps us serve our elderly and disabled populations. The other part of this is, a reminder that there is, with this program, I'm asking tonight for the approval of our grant application, and I apologize. I do have the full application here for anyone that would like it. I apologize, it did not go out in the packet. There is a match that the county does need to put up as part of this grant. And that portion is 25% of what we receive, the county has to bring back and match, and that's just over $38,000. That was a point that I did not have on your paper there. We also do have a trust fund with a balance of just over $5,000. And that trust fund, the only way that that money can be utilized in that trust fund thank you, Erica, for explaining to me, we need to have the approval of the Department of Transportation before we access that money. And that money we have put aside for, we don't know yet what's going to happen with that app that we were building, developing. That was before I was in now this position. So we need to figure that out now. But that was money that we were going to use for that application, correct? Okay.
So that was kind of like the Uber for human services, where we would be able to, have the app on phones to help coordinate drivers and riders. Is that up and running?
It is not, no. It was started and piloted, and right now it's not being used at this time right now.
Melissa?
Yes.
A couple questions.
Yes.
One, and probably more of them. This particular grant is something that the county has made application for and received for countless years.
Yes, this is a formality we have to ask for every year.
And this particular body needs to approve it.
Yes.
As part of the application process, is that correct?
Correct. Yes.
Okay, the transportation grant, we need a motion to approve going forward, or accepting it.
Make a motion to approve.
And second, of you. Okay, any discussion? Seeing none, those in favor signify by saying aye. Aye. Opposed? And approved. Good luck.
Thanks.
All right. Under point 3, personnel, employee update, resignations, retirements, recruitments.
Everybody received this wonderful listing that Liz put together. It's refreshing to say that, not having wood as of today, we've not had any resignations in the last 2 months. So, hopefully that, exodus has begun to wane, and we're headed towards some stability. By the end of this month, we will have all the management positions filled for those folks that left. We did hire, obviously, with Melissa taking on the ADRC unit. Thank you for doing that. We have hired Crystal for the ongoing manager in our families and children's area. And then we have extended an offer for the behavioral health manager that is working its way through. It looks like the HR has come to terms with that. We'll get the signed okey-dokey from the candidate, hopefully the next day or so, and then we'll move forward with that. Particular person has held a similar position in past counties, starting in Floyd County and in the mental health area, and is certified in CCS and CST. So we're looking forward to that. Provide some more stability.
Did anyone for the nutrition program?
There is still that position is still open, and we'll be interviewing. I believe
Monday.
We'll be interviewing Monday for that. We went to applicants, to the paper applicants this week, and we've got some good, I think we've got some good candidates there as well.
Thank you.
I noticed that, as well as yourself, some say new hire returning. And one of them, I think, left on January 3rd and then returned in July, and the other one was a shorter period of time. What kind of situation was that they left and now we hired them back?
We've got a couple different situations. One, at least one, maybe two, would be knee-jerk reaction. And have been able to convince that that's what it was. They realized what good things that serving Waupaca County citizens was, and have, I don't want to say sworn loyalty, but have had conversations about loyalty to county and the citizens of Waupaca, serving them where their loyalty is not placed elsewhere. And then we have one, the manager that was hired, who was gone very short period of time, had resigned because of some issues relating to school and their children, and realized that I don't need to be home, that they can handle it, and so she asked if she could come back. And it's a very, very good employee. Left strictly because of that.
Probably has nothing to do with anything, but it's my question. Because they resigned and were off our rolls, did we then negotiate with them to come back by giving them the same seniority, benefits, et cetera, that they had before? Or are they considered, because this says, new hire, are they starting then again from square one?
I don't know necessarily if it's where square one lines, but they were all negotiated kind of situations, except for the one that was on just for a couple of weeks.
Okay. Thank you.
Yep.
Any other questions? Resignations, retirement. Well, having been on the EHHS committee since the Stone Age, I have to say it's really gratifying and everything to have 2 months in a row without any resignation. I can't remember that ever happening. There always seems to be some turnover and sometimes a lot of turnover. But I think that going on up in the second floor, under the tutelage of Kevin and his staff and others, must be doing wonderful things and making it a place where people want to work and serve our citizens. So thank you, Jeff.
I don't know if I'm doing anything, Jerry, but I agree with you. It's refreshing that we've not had any, resignations these past couple of months. I think, again, I think there, in the spring of the year, there was a big rock thrown into the pond, so to speak, and the waves were pretty turbulent. I think those have calmed, and, I think that the folks who are in the halls are really wanting to do the work and to make it better. And it's hard with COVID. It's extremely hard. I think we're doing a great job.
Okay. Then we get to our director's report.
I did, simply supply again a short brief report for everyone. I guess the only thing to add to that is you will notice you did not receive this month the update from the program manager. The reason for that is there's a couple of reasons. One is, some folks with the holiday and those kind of things fell a little bit behind. But in conversations and those things, with the narrative format, we found that we were repeating ourselves over and over and over again. And we are looking at a different format after the first of the year that will involve more demographics and those kind of things. It'll be a little bit easier to read and not just 12 or 13 pages of narrative. That's all I have.
Oh, okay, thank you.
Mr. Chairman,
Yes,
may I suggest for the future, I enjoyed having those reports from the different areas. And I think what we need to do, because this last year as a Department of Health and Human Services, we did not present an annual report to the county board. And I think in your future, we need to do that because it allows us to educate them what our departments are, what they're doing, where we're at, what's going on. If we don't give a report, then the 5 new people who come on don't have a clue. And this way, the more we can tell them what we're about, I think the better off we are. So if we could, and I realize that you haven't been here yet, but if there's somehow where we can get, how are we doing kind of thing in front of them. There certainly seems to be time at our county board meetings where we could have a synopsis of how our department is handling things. Just a suggestion.
No, understood. I think it's a good idea.
the only thing, Pat, that I've said to Ted about that report that's coming monthly is that those people up there, especially under the circumstances that we're in now, have a lot on their plate, and I'm not saying they shouldn't have some sort of report, but we need to make that report educational for us, but is not too taxing for them. And if we can strike a balance, then I feel better about it. But I remember in my working years, when something came down the pipe, it was just saying, I'm doing this job, and now I've got this other thing to do, and it's not always the greatest for morale, but hopefully they're looking into it and they'll strike a good balance where we'll be satisfied and they will feel that it's valuable to put together a report to us.
Yeah, understanding issues. You go on, and it's the last paragraph. It is noted that staff continues to be concerned about COVID-19 and the ability to remain safe and healthy in the workplace. The AV schedule is working fairly well, and staff are adjusting, but there is still concerns. What are the concerns?
The concerns are simply again for their own safety and that whether or not they will be exposed in some way, shape, or form, even with the AV schedule and social distancing and wearing masks. I think it's just a concern that folks have. Trying to be as cautious as possible, but still at the same time, when someone down the hallway has tested positive, and whether what does that mean now? We've done I think we're going on a couple of weeks, Jess, to where we haven't had a lot of folks out. Quarantine.
I'm here.
So we have 2 trophy winners in the front pew here who have been out at least 3 times. So, but folks are still concerned about that. And, there's still some folks who are even reluctant, even with the AV schedule, to be on site because of that. It's a general fear.
And then I have one more. It's on page 2. I'm not understanding this, and it's under structural and operational adjustment within the department, and especially that second paragraph. There were some adjustments made to the purchase of services contract that we have been reviewed by the corporate council. The two primary adjustments were in the area of contact termination, termination language, and in the way in which a vendor's financial reserves are determined. Some vendors are pooling their revenue and reserves, which could lead to payment from Waupaca County actually covering costs of another county. I guess I'm not understanding, are they saving up all their bills and then sending it to us?
No, what happens, Jan, is, just to explain it, that we did clean up, Diane, and cleaned up some of the termination language, and we added some, working together with Erica to make sure that we're in control of termination of contracts as much as possible, given some past situations that were a little sticky. So we cleaned up that language. In regard to the reserve issue, a not-for-profit vendor is allowed to retain up to 5% beyond the cost of providing service. Now, it's not a big margin when you're in business, but if you're a not-for-profit, you just try to balance out. In reviewing a couple of audits that we had received a couple of years ago, and this has been going on for a long time, and we used to push on this really hard. A lot of the vendors are, at the end of the year, it's not like they're taking all that money necessarily and paying their bills, but they're taking all of their revenue and then all of their expenses and then determining, okay, here's 5%. Well, it really should be county by county by county by county. And if Toronto County, for example, isn't paying their way and they find that there's a deficit in providing services to that Toronto County resident, but there's money left over from Waupaca County, people have been pooling that and coming up with a 5%. So what we did was, within the contract, we had stated in there that the excess revenue and the reserves need to be established by service to Waupaca County residents only. Going forward, one of the things that we'll have a conversation about is whether or not we adjust that amount of reserves that a vendor can retain. Many years ago, we had reduced that to 2% because statutorily the word that is used is may retain, it isn't shall retain. So we had reduced that, and Gary, I don't know if you remember, we ended up capturing hundreds of thousands of dollars back from vendors over a couple of year period because of one, we hadn't been that active in going after that, but then by shrinking that reserve, that gave us a little better bang for our buck, so to speak. Right now, we're at 5%, and we just want to take a look at whether or not that really makes sense. Again, to try to reduce that a little bit, or if we just leave it alone. But that's what that.
Okay, thank you.
Anything else? Okay. Thank you, Ted.
You are welcome.
Board member reports of meetings attended and general correspondence. Is there anyone that, Jen?
Yeah, I did, tomorrow, I will be sitting in on a Zoom meeting for the state, or for the insurance. And it's on workers' comp, so I'm gonna be interested in seeing and hearing what they have to offer. And then I sat in on, one of the conferences, for Health and Human Service. And, one of the biggest concerns that I will have, and I think we should have, is coming up with monies for the aging program that we're going to be faced with in the near future. So, and they have a study group, and that study group is off the ground, and one of their proposed sums to leaders is 21 or 27 million for the ADRC program. That's what they're proposing.
Whether they did it, I don't know. But that's what we're really proposing right now. And that study group is in phase 2 right now. So
Thank you, James, for that. Anyone else? Okay, we're down to point number 6. The next meeting is 6th of January. By that time, you've all opened all your presents and sent half of them back. Things like that. I want to thank Ted for trying to get us in the Christmas spirit with his Christmas cookies. And anytime you want to get us in the spirit, we're willing. You're willing for that?
Ted should share what else he did to help get in holiday spirit.
What's that?
I've allowed,
playing Santa Claus.
I've allowed the beard to grow. I'm doing Zoom Santa. I got a suit, I'm an old fat guy, and so, what I've done is offered that up for folks to where I contact them via Zoom and talk to the kids. And I've got about 30 in the queue right now that waiting to do it. Did a few this past weekend, I just started, and it's been a lot of fun.
Spreading some cheer.
Trying to.
Okay. Well,
I'll make a motion to.
have a great holiday and safe holiday. And we'll see you all back here in January. And we have a motion to adjourn from Jan. Is there a second? Second by Dennis. Those in favor of adjournment signify by saying aye.
Aye.